When a woman reaches a certain age, our focus increases on our bodies, our appearances, and our health. My guest today is Dr. Natasha Chinn. Dr. Chinn is a partner with Brescia and Migliaccio MD PC. She's a trailblazer for women's health. Dr. Chinn's approach is to look at total women's health at every stage of her life. She's passionate about treating the entire being, which she describes as encompassing spirit, mind, and body. She's a strong proponent of identifying the root cause of her patients' illnesses and not just treating the symptoms associated with them. Welcome, Dr. Chinn. Thank you so much for coming today.
Thank you so much for having me.
So I'm excited to hear about this because you are a proponent of women's health at every stage of life. What interested you in women's health?
Well, I believe that women are the backbone of our society. We're the moms, we're the nurturers, and the caregivers. And I believe that because of that, if we take care of women, spirit, mind, and body, then in that way, that enables us to take care of families. That enables us to then take care of communities and society at large.
So, you're adept at every stage of women's health. Can you take us a little bit through those stages and then especially what we should start expecting at a certain age?
Absolutely. So as women, from the time we're girls, we go through different stages of life, right? So from the time a girl gets her first period and has development of breast and pubic hair throughout the reproductive years where there's childbearing to the time period that you're talking about, which is the perimenopausal and menopausal phase of life, there are various changes. Now, if we specifically talk about perimenopause and menopause, those changes are not limited to, but include everything from the infamous hot flashes to changes in your hair, your skin, breast tenderness, changes in your mental acuity, your libido, your vaginal dryness, and that's just to name a few. The other thing is there's an increased risk after the perimenopausal and menopausal age of things like heart disease, diabetes, etc.
And so talking again a little bit about menopause, some women seem to just coast through it, and other women seem to suffer more. So can you tell me a little bit about menopause and how to travel gracefully through it?
So menopause is this storm that we all, if we're lucky enough to live that long, will go through. And so the key is to really figure out what is the umbrella. And when you're talking about the umbrella with menopause, it's important to approach it from, again, body, mind, and spirit, right? So when addressing the body, what you allow into your body becomes important. When you're weathering the storm of perimenopause and menopause, you want to have an anti-inflammatory diet that's filled with vegetables and fruits. In fact, I usually recommend that women try to get 8 to 11, I know it sounds like a large number, servings of vegetables, mostly green leafy ones, and perhaps like 1 to 2 servings of fruit a day. Also lean protein, things like wild salmon, sardines, if you eat beef, grass-fed beef, and really to limit things like processed sugars and limit things, also limit dairy, cheese, because those things are inflammatory. The reason why we want to limit those things is because when we do that, those vasomotor symptoms that we have, so all the things that I mentioned before can be curtailed. The other thing is then we're getting adequate vitamins such as B6, which helps to calm our mind and can also help with hot flashes, magnesium, which helps with that as well. So having that healthy approach with body is key. And then in terms of the mind, good practices like exercise, meditation, yoga, those things will help with your mental acuity and also just to calm the mind and the spirit.
Now, what about, because you're mentioning, I'm still thinking about the diet here. What about those things which we love to have that maybe they're good, maybe they're not? What about coffee?
Well, coffee isn't all bad, and it also isn't all good. So coffee has been shown to have some benefits, like anything from increasing your metabolism and helping with weight maintenance and weight loss, to some studies suggesting that it can slow the progression of type 2 diabetes. However, with coffee, we have to remember a few things. First, we have to remember that it's a stimulant, and so the good part about that is it can help with your mental acuity. The bad part is that in excess, meaning perhaps more than 1 to 2 cups a day, it can make you jittery and actually have the adverse effect. The second thing is it also depends on what we put in the coffee. So if our coffee
and the extra sugar is not okay.
Extra large coffee that has lots of sugar and milk and creams and different flavors filled with sugar, then we're defeating the purpose of what we wanted to accomplish in the first place. And the third thing that you have to be mindful of is that caffeine is addictive. And so in excess, the hard part about it is if you try and scale down, many women, well actually men and women, will have headaches, drowsiness, grumpiness, and some have a really difficult time getting through their day. So it's good, but not all good, and there's some bad, but not all bad.
Oh boy, so I've got to be careful with the coffee. What about another favorite, chocolate? Is there any good in chocolate?
There is good in chocolate, of course, particularly dark chocolate in moderation. Dark chocolate has antioxidant effects, and so it's good. But again, you don't want to eat a pound of chocolate, and you don't want to eat chocolate that is chocolate. You want to really have a good dark chocolate.
So you want to have the real, when it says like 80% cocoa,
exactly,
that's what you want.
Exactly.
Okay. And what about, one more sin, but I love it, what about the red wine?
Well, red wine, again, the theme remains the same, right? But particularly when you're talking about alcohol, it's very important that you weigh the risks versus benefits and really know yourself. So if you're prone to addiction or you have a strong family history of it, then you might get the antioxidant benefits of red wine through something else, like eating grapes. However, if you don't have those things, then having a glass of wine, not a bottle of wine, can have some benefits.
All right, so some of us can, not us, some people can rock a bikini in their 50s. Can we all do that? Is it something we can attain? What does it take to look our best?
Well, all of us can wear a bikini.
In public.
All of us could wear a bikini in public. All of us might not want to. But in terms of body type and whether or not you might feel comfortable, first of all, of course, beauty is in the eye of the beholder, right? But if we're talking about a healthy body, healthy lifestyle, we have to consider that genetically we're all a little different in terms of body type. And that part we don't have that much control over. What we do have control over is what we put into, what we allow into our bodies, right? So if you want to wear that bikini, then again it goes back to having a healthy diet, preferably an anti-inflammatory diet. And also exercise as well. So then not only will you look good, but you'll actually be good on the inside as well.
And it sounds like a lot of this has to do with your mindset. How important is your mindset?
Mindset is key. You are who you think you are, right? And so a positive mindset can affect everything from your mood to your metabolism to really just how you go about how you treat yourself, spirit, mind, and body again. And so it really starts with the mind. And so things like meditation, yoga, things that help you to focus and really center on who you are and what you're allowing into your environment is key to how you ultimately live your life and the results that you see, body, mind, and spirit.
And does this tie into our stress too? I mean, I've heard stories about some women that they are so stressed they wake up crying.
Absolutely. Again, when we talk about stress, I always talk about the genetic predisposition versus what we can do. So there are some people who are have a strong family history of anxiety, depression, and mental health issues. And oftentimes, if they know that, then they can have intervention with what they allow into their body, as well as perhaps conventional or integrative counseling, and then practices such as meditation and yoga, things that help to center the mind, quiet the mind as well can help. And then we always go back to diet, right? So we want things that are high in like B6, which naturally helps to quiet and calm the mind. Magnesium, adequate hydration, all of those things can help to counterbalance anxiety. And the other thing is the environments that you allow yourself into as well. But once you have that mindfulness, then you can decide which environments are healthy for your mental health and which are not.
So from a holistic standpoint, how important are your surroundings, and like what can we do with our surroundings to make us feel better?
So we can allow ourselves to be in positive environments where there's good energy, where there is self-love there, really, as opposed to being in toxic environments where things are negative and you're taking on more than you can handle. So again, when you have meditation, then you can take that step back and say, okay, is this serving my purpose? Is this helping me to be my best self or not?
So maybe it's not just your physical surroundings, but it sounds like also the people that surround you and maybe what you do.
Absolutely. Absolutely. It's all connected.
Okay. And how important as you age, right? One thing I think people run into, a problem women run into is empty nest syndrome. Maybe a feeling of less self-worth. How important is it to start doing new things?
It's extremely important to not just do new things, but do things that are rewarding, right? So we go through these stages of life. Where we were yesterday is not where we are today, and it won't be where we are tomorrow. And so our environments, our activities, our purpose changes. So what our purpose was and what we wanted for ourselves when we were 10 years old changed when we were 25, 35, 45, and so on. And so really finding in this moment what it is that satisfies you, fulfills you, and is your contribution to our world at large in this moment is key. And understanding that that is not the same. It's fluid, right? So it's not what it was yesterday is not what it is today. And that's okay.
Yeah, and change is okay.
Change is not only okay, but it's normal and expected.
So you got to go with it.
Absolutely.
Now, we talked a lot about diet. Sometimes I think about, all natural. Is all natural necessarily good for you? If it says holistic, Do you know, is it okay to take? I mean, you mentioned a few vitamins, but where's the limit? What should we not be putting in our bodies?
So you always want to be careful when you see things that say, oh, it's natural, or, it's holistic, or this is, highly recommended as a natural approach. So if you take supplements, then I always recommend that your supplements say that they were independently tested or third-party tested, so that you know what it says it is truly what it is. And then all natural, there are not that many mandates on who can put what all natural is, and so not really an across-the-board definition for that. So that's why knowing what's third-party tested is key. Also incorporating a lot of live fruits and vegetables, because that's all natural, right? You know where that came from, and if you get it from a source that doesn't have a lot of additives or pesticides, then you can rest assured that that's fine.
Okay. What about, so we talked about changes in health. What about problems? So if I experience a change in my body, what should I be concerned about, and what can I just ignore?
So I don't think you should ever ignore the signs that your body's giving you. I really believe that our body speaks to us, and clinicians are translators. We help you to really interpret what your body is trying to tell you. So if anything from changes in your hair to changes in your reproductive system, etc., all these are signs. Sometimes it could be as simple as you need a good night's sleep. You haven't been sleeping enough. But it can also be as significant as a severe illness. And so no sign should be ignored. You should really listen to your body, really see how often you're experiencing whatever symptoms you're having, and then don't be afraid to address it. And don't sit and say, oh, well, I'm probably just tired, but this has happened to me every day. No, have it checked out. And it may be an issue, again, with the total being.
What about sleep? At a certain age, how much do we need? And I know insomnia becomes an issue. What do we do?
So sleep is extremely important. More and more studies are linking lack of sleep to anything from obesity to increase in heart disease and stroke, Alzheimer's, you name it. Sleep is imperative, and it's the recommendation that we get at least 7 to 9 hours a day, which for many people are like, what? Who has time to get that? But we need time to have that. In terms of sleep hygiene, you want to make sure that you are in a room without TVs, preferably, social media being placed aside, your phone turned off or silenced if you can as well, and really have a routine. Okay. For some people, they might diffuse things like lavender, or may play some soothing music right before. But really, it's a practice to really get into that mode of sleep. So now you're done with the day, it's time to sleep. When you're going through the perimenopausal and menopausal phase, one of the common symptoms is sleep disturbances and insomnia. And so really having that sleep hygiene is key, really making sure that your diet is rich, again, with B6, magnesium is also key.
So when you talk about routines, is there any taboo about when you should stop eating at night? Is it okay to have a snack right before you go to bed? Does it matter?
Well, preferably, you want to stop eating 2 to 3 hours before bedtime. Because remember, when you're going to sleep, you're allowing your body to rest. And part of your body is your digestive system. So right before you sleep is not the time to have that fried food, yummy snack, or those chips. Because now, while your body is trying to rest and heal and reprocess, it's now forced to also work. So about 2 to 3 hours before bedtime is advisable.
And what about, again, alcohol and caffeine? Does that, I mean, assuming that impacts your sleep, but is that something you should stop early, or does it help?
Well, remember, caffeine is a stimulant.
Right.
So when it's time to sleep, you don't want anything that's going to keep you awake or is going to keep you from staying asleep. So you want to stop drinking coffee also about 2 to 3 hours before. In terms of alcohol, some people might think, oh, but alcohol relaxes me and it puts me to sleep. But it's not the same sleep pattern as your normal one. Okay, and not only that, but for some people, the actual alcohol can irritate their digestive system. So once again, your body is working harder than it needs to at that time when it's supposed to be resting and healing. And so also 2 to 3 hours before bedtime.
Okay. And now, what are some, we had talked about health conditions, but what are some things that women should really look for? You don't hear much about heart attacks in women, but I hear it happens quite a bit, or diabetes. Like, what are some age-related conditions that are going to be more common we should be looking for?
So heart disease, like you mentioned,
Okay.
diabetes, obesity, high blood pressure, sleep disturbances, changes in eyesight.
And what are some symptoms of all those things we should be looking for? Like heart attacks, what should we be looking for?
So one of the reasons that I am so interested and dedicated to women's health is because we women present differently when we have certain diseases. So for example, with heart attacks, we don't always present with the classic left-sided pain in our arm or and feeling like an elephant set on our chest. Oftentimes women may have GI disturbances, meaning a stomach ache, or just feeling kind of just uneasy, or just having like difficulty taking in a deep breath. Things that are different than the classic symptoms that we all read about. And so even with things like diabetes and high blood pressure, women might have things like, oh, I had, keep getting this headache. Or, oh, I had to blink a few times because I wasn't quite seeing the way I was before. And that's why really not ignoring the changes in your body is key. Because what you might take as, oh, I just have a little indigestion, maybe I ate, too much of one food versus another, might be your body telling you that, no, we need to check your heart. We need to check your lungs.
And how important is it? I mean, we need our regular physicals, right, once a year.
Yes.
Is it important to also go to your OBGYN? Is your GP enough? What doctor should you be seeing? Again, as you age, which ones become more important?
So as we age, and it's really based on our medical issues. First of all, yes, you should definitely be seeing your primary care clinician yearly, and your OBGYN as well. In addition to that, who else you see is really based on what your particular situation is and what particular medical issues or predispositions you may have.
And what about mammograms? For a while they were saying, oh, every other year, every year. What do you recommend?
So according to the American College of OBGYN, which many of us are fellows of, we still recommend that you go for a mammogram every year. And if you have a history of dense breast, you should have not only a mammogram, but also an ultrasound. Some women will need to have an MRI or, further imaging, but that's based on what the initial findings are or what their history is.
So you had mentioned before that medicine is really different between the genders. Where's women's medicine going now? How is it changing?
Well, the field is changing because now there's more attention and studies being done on women. And now we're coming to the realization that women present with their diseases differently than men. And we're starting to be aware of it. And awareness is key to really know the questions that even clinicians should be asking the patients, and also for patients to know the questions that they should ask their clinicians as well. So the field has definitely evolved from 50 years ago. There's still more change to be made, more studies to be done, widespread, but overall we're looking good in terms of the direction that we're going in.
And now what about women's sexual health? They always ask about that as we age. I know that's a field that you specialize in. How are our bodies changing in that regard?
In terms of perimenopause and menopause, one of the common symptoms is decreased libido, and vaginal dryness, and pain with sexual intercourse. And the reason why that happens is because when we're in this stage of life, our estrogen levels decrease. And estrogen is what gives the vaginal tissue its vitality. It's what we need for our libido and what we need to really enjoy sex. And so my question every day I'm asked, so what do I do, right? And do I need hormones? And can something be done, really, is the first question. And the answer to that is always yes, right? So again, in terms of controlling those vasomotor symptoms, healthy diet, anti-inflammatory diet definitely helps with sexual health. In terms of vaginal dryness, I usually recommend that women use a natural approach first, so something like coconut oil. There are a couple of studies out that show that coconut oil may have some similar properties as estrogen cream without having the hormonal effect. And of course, there are vaginal creams, vaginal estrogen creams that can be placed in the vagina to also help with the integrity of the vaginal tissue and therefore improve the sexual experience. And then there are also natural supplements, things like there's one called maca, which maca is a root from Peru. It's in the same family as broccoli. But what maca is it's what we call a natural adaptogen. So basically what that means is it naturally helps to regulate and balance out our hormones. And so many of my patients incorporate that into their diet in powder form or pill form. And there's a slew of other supplements as well. But yes, there is an answer to it. It can be controlled, and usually we try natural approaches before trying the hormones. Right, just to really minimize side effects but maximize the benefits.
Excellent. Well, thank you so much for all the information you brought today. I think we've learned a lot, and a lot of things that we needed to know about how to age gracefully. So,
Absolutely.
Dr. Natasha Chinn, thank you very much.
Thank you.